Hi, good morning and good afternoon, everyone. My name is Rachel Stepka. I'm the Youth Power Learning Communications Manager. Welcome to our webinar hosted by the Cross-Sectoral Skills Community of Practice, the importance of social and emotional skills in achieving youth outcomes. So just as a quick introduction for Youth Power Learning, for those of you who might be unfamiliar with our project, our goal is to advance knowledge to transform the lives of young people. So Youth Power Learning generates and disseminates knowledge about the implementation and impact of positive youth development, or PYD, approaches in international development. So what is positive youth development? PYD programs recognize youth's inherent rights and result in youth who have assets, the ability to leverage those assets or agency, and the ability to contribute to positive change for themselves and their communities, surrounded by an enabling environment that supports them. So how can we partner together? There are many ways to get involved with Youth Power. First, you can visit our learning hub, youthpower.org, to share resources, events, information, and what works in youth development. You can also contribute to our PYD learning agenda, where we're identifying what works and measuring PYD. So send your youth-related resources to info@youthpower.org. You may also engage with our platform, youthlead.org, which is for young changemakers around the world. You can join if you're under 35 years old as a member, or become a sponsor if you support youth networks. Finally, you can enjoy and engage with our 4 communities of practice. We have 4 different sector areas: youth and peace and security, gender and PYD, youth engagement, and cross-sectoral skills for youth. With that, I'm going to pass it on to our moderator, Hilary Proctor. Hilary, over to you.
Great. Thank you, Rachel, for the overview of the Youth Power Learning activity and positive youth development. I would now like to welcome all of you again to the webinar on the importance of social and emotional skills in achieving youth outcomes. As Rachel said, my name is Hilary Proctor, and I'm the Director of Technical Services at Making Sense International. Olga Merchant and I are the co-champions of the Cross-Sectoral Skills Community of Practice, and today we are pleased to be sharing with you the perspective and experience of USAID and Mercy Corps on developing social and emotional learning skills, commonly referred to as SEL, with young people. For our webinar today, we will be hearing from Hilary Proctor, who is the Education and Program Analysis in the African Bureau at USAID. Hilary was one of the key authors of USAID's brief on social and emotional skills that was released in the fall of 2019. Today, she will be sharing with us an overview of this brief and critical insights to developing social and emotional skills with young people. Our other speakers today are Salih Haad, who is the Capacity Building and Quality Management Officer with Mercy Corps in Jordan, and Matt Strang, who is the Director of Mercy Corps' Young People and Protection Technical and Support Team. These 2 will be sharing with us their experience of integrating social and emotional skill building into their programs, and with a special focus of their work in Jordan and working with refugees. We hope this combination of USAID and Mercy Corps' presentation will help provide our community of practice members with both a high-level vision as well as a grounded perspective of integrating social and emotional learning skills in with youth. It is a pleasure to be hearing from the 3 of you today. Before we turn it over to our presenters, I would like all of our listeners to feel free to send any questions that you have to the presenters in the chat box on the right side of your screen. At the end of the presentation, we will put these questions forward to our presenters for a brief Q&A. With that, I would like to go ahead and turn it over to Kaylee.
Thanks, Hilary. Good morning and good afternoon. As Hilary said, my name is Hilary Proctor, and I work at USAID and Africa Bureau. I also serve as a co-chair of the Social Emotional Learning Working Group. Very excited to be part of this webinar this morning. I'll be providing a brief overview of background of the evolution of USAID's focus on SEL and soft skills, as well as an overview of our recently published policy brief on social emotional learning and soft skills, and some of our next steps for the sector. So how did we get here? USAID's focus on SEL really originated from a dialogue with partners about the importance of building these foundational skills in our programming to contribute to a wide variety of outcomes for children and youth. So we've seen a lot of investment in this area in the space of education in emergencies and youth workforce development, but there's also been a growing awareness of how these skills contribute to other outcomes, such as improved academic outcomes, violence reduction, and gender equality. So this SEL was incorporated in the 2018 U.S. education policy. Social emotional skills are a priority learning outcome listed alongside literacy and numeracy. And the implication of this really is significant because previously the education strategy only prioritized reading and access as our education outcomes. So now there has been a broadening of that, and which opens up opportunities for partners to expand into this technical space. Social emotional skills, we're talking about across the entire spectrum of education, so that's covering pre-primary to higher education, and also they're relevant in conflict and crisis as well as stable context. So after SEL was included in the education policy, at USAID we formed an internal working group to further catalyze these investments and develop resources in this area. And I just want to acknowledge that although our agency and the sector has been working in this space for many years, this is really the first time that we came together as a sector to make sure that we had a shared understanding of this area. So last fall, we published the policy brief on social emotional learning and soft skills. This provides an introductory understanding of what USAID means by these terms and how to communicate about them. We recognize that it's quite easy to get hung up on this terminology issue of what are we talking about the same thing, what do we need by these terms. So that's a main goal of this brief, to give some really practical do's and don'ts about how to communicate about these skills with different stakeholders. We also, in this brief, outlined the desired outcomes and quality standards for programming that teach social emotional skills or soft skills. And we also identify areas in which the evidence and best practice still have gaps, and there's need for further learning. But I also wanted to note that it's important to say what this policy brief does not do. It does not prescribe one framework of skills. While it cites some evidence-based frameworks such as the PYD framework or the CASEL framework, we felt that narrowing it down to one framework or one specific list of skills could really limit programming, since the skills needed often vary depending on the wide array of different contexts and outcomes that we work towards. All right. So what are social emotional skills? What do we mean by these terms? The umbrella term social emotional soft skills refer to a broad set of cognitive, social, and emotional competencies that affect how children and youth interact with each other, solve problems, make decisions, and feel about themselves. I just want to say that there are a lot of other terms that many donors, partners, and disciplines use. While the field of psychology and education often use the term social emotional skills, we also recognize that the private sector and disciplines of economics and agriculture, workforce development often use the term soft skills, transferable skills, life skills, or non-cognitive skills. You'll also hear colleagues working in gender and global health often use the term life skills, which social emotional competencies are a key subset of these skills. And then practitioners from humanitarian or social service backgrounds may use the term psychosocial support or holistic well-being. But for the purposes of USAID's work in education, and as outlined in the policy brief, USAID will continue to use the term social emotional skills for basic education programming and the term soft skills for youth workforce and higher education programming. But we really recommend that partners kind of move beyond these overarching category terms and instead explicitly name and define the sub-skill and a measurement approach. So it's important to establish a shared language and vision with country stakeholders and key ministries. and make sure all stakeholders agree on what are the outcomes that we are seeking and what is the role of these skills in achieving those outcomes. What is the theory of change? Okay. So just to unpack these a little bit more, the terms cognitive, social, and emotional competencies, those are the three categories that are well accepted in the field and have been embraced by UNICEF, Harvard, and many of the other leading researchers. So what do we mean by these three categories? Cognitive skills are the skills that are really having to do with thinking, memory, attention control, response inhibition, decision-making, and goal setting. Social skills is more about social engagement, communication, negotiation, and emotional skills are all about your emotional knowledge and expression, emotion and behavior management, ability to empathize with others. So within these three domains, there are many, many different sub-skills. And often people are using different terms to refer to these individual sub-skills. So one resource I wanted to just plug is the Explore SEL web platform that was developed by the Harvard EASL Lab. It's a really amazing interactive online platform that allows you to explore these different sub-skills and how their definitions may vary across the different international and domestic frameworks. Okay, just want to briefly go over some of our principles for programming in SEL. The first is to make the theory of change explicit. Identify the role that specific social emotional skills or soft skills play in achieving the desired outcomes in the results framework. It's also really important to understand the starting point for children and youth, the adults who teach them, and their families and caregivers. Should make sure that we tailor the way teachers, instructors, or faculty articulate, teach, and measure SEL skills to the specific cultural context, the prevailing social norms, and the age, developmental stage, and sex of beneficiaries. It's also important to provide opportunities to practice and apply these skills. Ensure that the instructional content and other activities that is appropriately sequenced, active, focused, and explicit instruction. We recommend that instruction is in combination and not in isolation with other topics, and also it can be taught in a myriad of ways beyond academic lessons, including play-based learning, service learning, and extracurricular activities. I think we'll get into those in the Mercy Corps presentation after this. It's also important to ensure that the learning environment and the relationship between learners and their teachers provide positive opportunities to practice and reinforce these learned skills. At a minimum, the learning environment must be physically and emotionally safe. And we should train staff on referral pathways to child protection or age-appropriate health services. Right. Sorry about that. Also, we need to consider how to place SEL into existing systems. Whether we want to do school-based programming or community-based programming, it's important to look at these different entry points into the system. We want to start with teachers and adults and developing their skills before we move to working directly with children and youth. Or what are different opportunities to integrate SEL into the curriculum or teaching and learning materials. And last and definitely not least, it's important to measure social, emotional, or soft skills. And we should be measuring skills at the baseline, end line, and also along the life of intervention at critical points. And measuring results of the programs will help grow the evidence base for the context in which we work, even though we recognize that some validated tools for measuring social, emotional skills or soft skills are really still emerging. Okay, here are a couple, I just wanted to briefly share some of our learning priorities that are listed in the SEL policy brief. There's still, while there is a lot of evidence, it's still growing, especially in the context in which we work, especially evidence around intervention effectiveness, cost effectiveness, and causal mechanisms. Also, we want to learn more about the measurement of skills and outcomes across specific ages and stages, and the role and meaning of gender, power, culture, and privilege in skill development, as well as inclusive learning environment in skill development. Additionally, we're looking into the role of technology and how to bring effective interventions to scale within education systems. We also are looking into higher education partnerships and how they can create contextually relevant research and measurement and prepare the workforce. So where can you learn more? On the USAID Education Link site, there is a landing page on SEL. I'll make sure to share that link in the chat box. And that's a great place to find our policy briefs, a lot of our relevant blogs, some other curated programmatic resources. So what are our priorities for moving forward this year? So, well, after releasing this policy brief, we recognize that that's really just the first step, and there's a lot more work to be done. So we're currently working on technical guidance on how to integrate social emotional skills into primary education programs. We're also working on indicator guidance as well. We are making some evidence products, working on a systematic review as well as some smaller evidence briefs, and also specifically looking at the relationship of gender and SEL in a literature review. How can you get involved? The Global Education Conference coming up in early April will have a lot of relevant sessions on social emotional learning and soft skills. We also have started a listserv of SEL champions, and I'll share my email. If you want to get part of, join that, you can shoot me an email. As I mentioned, there's the SEL toolkit page on Education Links. And then we also really are welcome opportunities for our partners to come and speak to us, our working group and wider community of practice. So please do get in touch with me if you have a project that or some new research that you'd like to share with us. We're always looking to learn for you. All right, and with that, I think I will pass it over to Matt.
Yeah, thanks, Kayleen. Good morning, everybody, and thanks for joining the webinar. I just wanted to start with this photo and emphasize that what we're really talking about throughout this presentation and the program that Sala will go into much more detail on is about relationships, right? Human relationships for young people. Those might be with caring adults, those might be with parents, might be with teachers, coaches, other community members, but I don't want us to lose focus on the quality of those relationships is really what's going to enable the learning of social emotional skills and many of the skills that Kayleen just mentioned. So I start with this photo because I think it's a good symbolic reflection of those relationships and how the human connection is what's going to allow for the social emotional learning process to be most effective. I will hand over most of the presentation today to Salah, who is with Mercy Corps in Jordan and who's been working as the training unit officer on the Nubader program there for a number of years. But I did want to start by just giving a brief overview of how Mercy Corps approaches our work with young people. And this visual on the screen at the moment is what we call our future-proof framework. It's a conceptual framework that we use with our country teams and program teams to articulate how we approach our partnerships with young people. And I'll describe it in a minute, but really what it's detailing is, how can we partner with young people in meaningful ways to transform what might be current or future challenges, and this might include past exposure to psychological stress, into future opportunities for productive civic and economic engagement. And so you can see here, I just want to call out as it relates to this presentation, safe and supported, this gray circle around the red area, is a critical foundational piece in many of the places where Mercy Corps works, coming out of conflict or natural disaster. We want to emphasize that without the emotional skills and the safety and the social support that enables young people to learn new knowledge and skills, as you see up in that upper left-hand corner, or engage meaningfully in participating in civic or community engagement, or take advantage of economic opportunities, without that safety and that support, we really won't achieve success or the intended outcomes in those other areas. And then just briefly to call out, the circles at the very top are really the outcomes that we seek to achieve through our programming, and that is that young people are contributing economic actors, that they're healthy in mind and body, and that they're peaceful and productive members of their communities. I will call out that in that knowledge and skills red piece of the pie, if you want to call it that, is very much where our social emotional learning programming takes place, including soft skills and as well hard and technical skills. So just to give you a bit of an overview of how Mercy Corps approaches our work, I think a lot of people see synergies with positive youth development here. But I want to hand it over to Salah at this time so that he can dig into the details of this particular program. But just to mention that this was a program that took place over multiple countries in the Middle East as part of the Syria response. Programming took place in Lebanon, Iraq, and in Jordan. And Salah will talk to you in more detail about the program in Jordan. So Salah, over to you.
Hello, everybody. Thank you for joining the webinar. I'm just get you a little bit brief about me. I'm Saleh Ahmad. I'm working with Mercy Corps for 3 years. I'm working with Nubader program. This project is applied across the 11th region as part of Mercy Corps emergency response to the humanitarian crisis in Syria, with the support provided at the regional teams, whom we've adapted the framework according to their specific context in Lebanon and Iraq, as Matt mentioned. This tool can be useful for application and support of young people in similar circumstances in Arab region and across the world. The goal is to provide non-specialized psychosocial support to at-risk youth by working with them, their parents, their community, and creating safe spaces, because we believe that's not enough to work just with the youth. We have to work with the caregivers and the community. In Jordan, we started the project in 2014. Our goal was young people from 12 to 25 years old, Jordanians and Syrians. Age groups are divided according to developmental needs, to 12 to 14, 15 to 17, 18, 19, and from 20 to 25. All age groups take the same components, which different is how activities are given. The Syrian youth have been living in Jordan in local communities for only 3 years before we start the project. Actually, we covered 10 cities across Jordan, and we have reached large numbers during the last years. For example, the number of youth who have completed 79%, that means who attended 18 sessions from 24 sessions, is 8,192 males and females, and in the parenting program we reached 1,879 fathers and mothers. Finally, the number of indirect beneficiaries is 97,450, like community projects and graduation ceremony. Our work being by building the capacity of volunteers and community centers for profound stress and attunement and capacity building training. We provide foundation psychosocial support training for all staff and volunteers responsible for managing and implementing community center activities. The goal of this training is raise people's self-awareness by understanding the response mechanism in brain and body under profound stress, using an interactive approach based on cognitive neuroscience, and actually to design curriculum for the 24 session with youth. If you look to this model, this is the sandwich model. It's built based on layering for the 24 session. In the first layer is the youth take the technical skills such as art and sports. On the second layer, we call wellness platform is works to improve mental health, like learning about brain or breathing techniques or meditation. And the third layer is life skills, and we focus just on four life skills. We focused on communication and self-esteem and problem solving and decision making. The fourth layer is a youth development plan, and we will talk about it later. Finally, at the end of the 24th session, the youth implement the community project. The profound stress and attunement framework, and known as the Hearts and Heads framework. This framework provides a solid platform for developing adolescent abilities, strengthen their empathy and psychosocial resilience while addressing their development needs. It was also found that is improves their psychosocial well-being measurable way. These results were counseled the research conducted in collaboration with Yale University, and I think Matt will talk more about this research. The PSA framework is based on latest research in cognitive neuroscience to enable the self-confidence of adolescents and to strengthen their ties with their families and the support circle surrounding them. One of these ties is their relationship with mentors who provide thematic educational service. And this service will be later implemented in training session and established spaces and the clubs for adolescents in their community. Actually, social emotional learning as important component that sits under the PSS umbrella. It's important component of PSS that educators can and should advocate since it's practiced easily and often employed in educational settings, and one that contribute to children and youth improve psychosocial well-being. It's pedagogical practice and process that especially fitting in both formal and non-formal education environments, since it promotes the skills and abilities that help children, young people, and adults learn. The overall focus of both PSS and social emotional learning intervention is building resilience in order to foster positive adjustment following trauma. However, social emotional learning can be non-specialized. And now I want to talk a little bit about youth development plan. The youth development plan booklet is one of the tools that we are designed and developed by the training unit. YDP or Youth Development Plan introduced by coaches in segments throughout the life of 24 session and contains five core topics: my health, my education, my relationship with others, my skills, and my safety. The youth development plan topics are presenting through implementation of practical activities on each topic. After that, the young people do the reflection based on what they learned and the activities on their lonely. This is what we do in Mercy Corps Jordan with our community and our youth and caregivers. Actually, Matt will show some outcomes we find it through these 5 years maybe.
Great, thank you, Sala. Just to capture some of the collaborating, learning, and adapting that took place as part of the program and call out some of these in particular. As Sala touched on above, this was very much based at a community level. This was not school-based, but this was community center-based programming. And the relationship between coaches and young people was really that focus of the skill development and social emotional learning process. So in terms of collaborating at the community level, the community-based organizations that hosted the community centers were a key partner. And I would say the investment in those community centers was substantial, in particular the training of the staff on the methodologies that Salah just mentioned, as well as the creation of a safe space for both young women and young men. These centers served as the focal point for all of the activities, except for some of those activities that were community service projects that took place out of the centers. But the centers were really a hub for coordination and collaboration across parents through parent engagement and parent courses and positive parenting, as well as referral mechanisms for other community services that young people might need access to. I would say that coaches and community center staff also collaborated very closely with school staff, teachers in particular. If a young person was needing additional academic supports, oftentimes teachers and community center staff would be collaborating on how to provide that young person with that additional academic support. And then finally, we created what was called the community-based protection networks. These were essentially a committee of local officials as well as parents and committee center staff who worked on any other protection needs that were arising within the Syrian or the Jordanian host community youth. I would say that local officials were engaged as part of those community service projects that I mentioned earlier. Other examples of collaboration across the project were the No Lost Generation initiative. This was an initiative that was started up by UNICEF as part of the Syria response, is ongoing. But Mercy Corps, alongside at the time Save the Children and NRC, were co-leads and advocated heavily with UNICEF to expand their reach and their funding efforts to include adolescents and young people. At the time, it was very child-focused early on in the Syria response. And Mercy Corps, alongside those other peer agencies, were effective in expanding that scope. And then also I'd like to highlight, and we might get into a little bit more detail on this when we talk about the results, but locally driven research. We were lucky enough to layer on a randomized control trial as part of this program, and much of that work was carried out by the Hashemite University in Jordan, a woman named Dr. Rana Dajani and her Jordanian research team. And I think without that local research entity and the cultural acceptance of those research team members, we would not have achieved the success of just carrying out the randomized control trial that we did. In terms of learning, significant learning was an adaptation of an existing tool called the Child and Youth Resilience Measure. Catherine Panter-Brick from Yale University is on the call today, and she and her team of other researchers were able to engage a number of young people in adapting the CYRM into an Arab version of the CYRM. They interviewed 603 young people ages 11 to 18 years old and really established a much more contextualized version of that child and youth resilience measure, which was a great learning piece as part of the program. And then the last piece here, the last two bullets around investing in mentors and coaches, both their selection and their development and their capacity building, as well as ensuring safe spaces and both physical safe spaces and socially safe spaces for young people were other critical learnings. I would say, one of the key pieces not found within the randomized control trial, but another third-party evaluation done on the program was that young people, both boys and girls, spoke again and again about how valuable their meaningful and caring relationship was with their coaches at the center and how meaningful those centers were as a place where they could build their identity and spend time and have access to. In terms of adapting, there was early on a culture of adaptive management and learning circles between program staff and center staff, which took place weekly to just review and raise issues that were taking place as the activities were being delivered and brainstorm solutions to those issues. There was also a practice of any adult mentor or coach following their sessions would self-reflect and fill out session reports and allow the rest of the center staff and others to review those session reports and provide feedback as part of that. So we did realize early on, and partly due to some of the early research done by Catherine and her team, that the dosage of the program as it was initially designed early back in 2014 was much shorter than we needed it to be. So we were able to extend the duration of the program from 16 sessions to 24 sessions, which is essentially from an 8-week intervention to a 12-week intervention. That allowed us to just build out and extend the dosage and provide a diversity of different activities, including some more social emotional learning skills for young people participating in the program. Another thing that the research told us early on was, and this was out of the adaptation of the Arab Child and Youth Resilience Measure, the value that young people put on their family ties and family relationships. We had early on in the program not designed in as much parental involvement other than awareness raising and permission to have their young person attend sessions at the center. So we reconfigured the design and spent a lot more time and effort and resources in parental involvement. And what that looked like was parents, both fathers and mothers, coming into the community centers, receiving parenting classes on positive discipline and positive parenting, and also understanding the neuroscience behind what their child might be experiencing from a neuroscience perspective regarding their exposure to chronic or toxic stress, and that much of the behavior that parents were seeing was a natural reaction to abnormal circumstances. So that was an improvement, an adaptation of the program over time. And I would say, one of the things just scheduling wise that worked really well was fathers were available on Fridays and when they were not working, and mothers were available throughout the week. So there were dedicated times that those fathers and mothers would come in individually and then as a group receive that parenting class. The other piece that was an ongoing 5-year process, to be honest, was demystifying the neuroscience. I think there's a lot that's been found, and the research being done on the neuroscience, especially for the adolescent brain, is growing, and kind of new things are coming out on a regular basis. So we wanted to be responsive to that research, and we wanted to communicate the neuroscience in a way that was clearly understandable, that was not creating distance between coaches and young people and their parents, but to really allow young people and their parents to understand what their feelings were grounded in, and how that was, again, a normal response to abnormal circumstances. So, I would say that this was something that a number of consultants helped us build out, not only grounding the approach in this neuroscience, but also how we could effectively and more, in layman's terms, communicate the neuroscience for our program participants. I will call out just another effort to do something very similar by a researcher out of Beyond Conflict, Mike Ninkunchuk, who is advancing efforts on what's called a field guide for barefoot psychologists, which is very much also in line with trying to just demystify the neuroscience and make it more accessible to people within these communities who are not formally trained as psychologists or psychiatrists. To move on to some of the results from the program, and as I mentioned, Dr. Panterbrick is on the call and may be able to expand on this once we finish up, but I will just give you some quick overview in the next 5 minutes or so of some of the primary findings. The randomized control trial was carried out by Dr. Panterbrick and her team at Yale and the Hashemite University. As I mentioned before, they administered the Arab Child and Youth Resilience Measure. This was a pre-post and also 11 months after the young person had finished their involvement in the program. And some of the key findings, we did see that young people reported reduced levels of insecurity and mental health difficulties based on that survey. That was an encouraging finding. Those were modest, but statistically significant. We did not see a change in social support aspects of resilience. So that was an area that was, I think, an area that we, despite deeper parental engagement and the role of the coach, was kind of a confusing finding for us, and something that we need to dig a little bit more deeply into. As part of the independent evaluation, not the randomized control trial, a couple of other key findings that we noted were A focus on tolerance among Syrian and Jordanian host community. We were concerned about social cohesion issues, and so we asked a number of questions around social capital and social cohesion. We did see that among 15 to 19-year-old boys, especially among the host community, the Jordanian boys, greater and significant increases in social cohesion and acceptance of outgroups, which was essentially acceptance of Syrian refugees living in their host communities. So that was designated as somebody of a different nationality. And then for young girls, we noticed a demonstrated and sustained enhancement of well-being, and in particular, something that was sustained and durable after the end of the program was their safety and security measure. So the ability to come into a safe space to work with a female coach on a regular 2 times a week basis seemed to work well for, in particular, adolescent girls in the program. I would say that that was also an adaptation that early on we realized that adolescent girls were having a hard time accessing the centers, so we did engage with local bus companies to arrange for contracts that would allow adolescent girls and boys to be able to travel free of charge to the centers. To continue with the results, I would think some of the most exciting findings from the randomized control trial are we were able through the Ashmont University and Yale University to conduct collection of biomarkers through hair samples and essentially measure cortisol levels, hair cortisol concentration as a marker of stress. And so we did notice that in the intervention group, those with high levels of cortisol dropped by 1/3, and that was a modest but significant finding. That was in comparison to a control group that did not receive the intervention. And then also among those who had abnormally low cortisol levels, so that they were not having kind of the level of cortisol that would help them, with their social emotional interactions and their stress response and managing those stress responses, that among those that were part of the intervention, those low cortisol levels rose 60% compared to a non-intervention group. I think one of the interesting reflections on this is that the biomarkers really did corroborate self-report changes of improved psychosocial well-being. And while it might not be possible to have the resources or the research team and the duration to conduct a randomized control trial, at least within this population and in this context, it does seem that self-report was consistent with those biomarker results. So that was an encouraging finding. And then finally, with more recent research that was done with the same population of young people, this was by Dr. Alexandra Chen out of Harvard, was really trying to look at the impact of past exposure to adverse events or past exposure to trauma on cognitive function and working memory. And that was in comparison to self-report of current poverty or current psychological stress levels. And so essentially what this was looking at was how much did either past exposure to stress or current exposure to stress impact cognitive functioning or working memory. And what Alexandra found was that what was more a contribution to working memory and cognitive functioning was current levels of poverty, and how current levels of stress impacted what was essentially some short-term and medium-term memory exams that young people would engage by going onto a computer and answering some questions as a way to measure cognitive functioning and working memory. And so I think what this does is it really opens up discussion about how programming can work to reduce poverty or stress caused by poverty to improve learning outcomes. And I think, what we're asking ourselves, and I think the debate that's ongoing is, what other complementary pieces might be added to social emotional learning or education or workforce development programming that would reduce stressors associated with poverty, whether that be engaging in an entire family or a household in a graduation model type approach or cash programming. And I think, if we can, based on this research, the question is if we can mitigate some of the stress or the high levels of psychological stress in the present, more so than alleviate past exposure to stress, that might open up pathways for enhanced learning, not only of social emotional learnings, but also academic and workforce development. related learning. So that was a brief overview of those results. All these results have been published, and we can provide access to those publications. But I would like to stop there and leave about 15 minutes for us to engage in Q&A. So I think for that, I'll hand it back over to Hilary.
Absolutely. Thanks so much, Matt. We do have quite a few questions that have come through the chat box, and as more questions come up, please do put them in the chat box and we will address them as we have time. So the first question that came through is from Maureen from Peace Corps, and she's curious to know how many organizations like Mercy Corps, which have an education sector and a youth sector, are distinguishing between the social and emotional learning and the soft skills, life skills, when you're looking at that skill continuum. So kind of taking us back to that beginning of the presentation where, Kayleen was talking about the difference between these and that continuum of skills development. And so I don't know, maybe Matt, if you want to take that on first, and then also Kayleen, maybe if you can speak to some of the perspectives that you've seen from other programming outside of just Mercy Corps.
Sure. Yeah, I think Kayleen will be the best place. But just to respond from where I sit, I think one of the things that the policy brief, USAID policy brief on SEL does is really challenge organizations like Mercy Corps and others to be very pointed and specific about which constructs within social emotional learning a program is intended to teach. And I think for a long time we've been lumping these terms together, whether it be psychosocial support, social emotional learning, and soft skills, just saying that any of those skills would be a benefit to a young person and would allow them to continue to function more positively within their communities or within school. So I think the challenge that we've presented ourselves, and I think that others should feel are presented to them, is how do we, through a very targeted theory of change and very specific naming of particular skills, then kind of work backwards with how we're going to develop those skills and how we will measure the acquisition of those skills over time. So I think it's still relatively early in that process, but I think the policy brief does go a long way to start to at least hold or put forward a minimum standard as to how organizations should approach that. So Kayleen, maybe you want to respond to that as well?
Yeah, thanks, Matt. No, I think that's a really good point, and we've had a lot of discussion around this. And when you actually look at, life skills, soft skills, social emotional skills, there's really a lot of overlap in all of the different frameworks. And like I said, that Harvard tool that is linked in the chat box is a really good resource in kind of navigating all these frameworks. But so we're trying to encourage partners not to get hung up on what those kind of categorical terms that you're using, but like Matt said, get down to the actual sub skill that you want to measure and see how it's fitting in your theory of change.
Great. Thanks so much for both of your responses for this. The next question is probably back to the Mercy Corps team, and then it's asking specifically about your programming in Jordan. And this question came from Chelsea, and she wants to know, how did you do any analysis or make any modifications to address the gender differences in parenting or emotional expression? And so really kind of getting into how were programs adjusted for the females. And I know that you spoke a bit later on in your presentation about some of those adaptations for AGYW and really making sure that they had that access to that safe space. But if you could go into a little bit more depth there, I think it'll address a lot of what Chelsea's looking for.
Yeah, I might ask Salah to jump in on that one. So Salah, I guess the question around how were gender dynamics considered as part of the implementation and adaptation of the programming, whether with parents or with young women and young boys in the program?
Okay. Actually, we get very simple in other applications.
Salah, your microphone is a little bit quiet.
Can you hear me right now?
That's better. Yeah, thank you.
Okay. I'm just talking about we do something like learning circle every week on our location, and we can actually solve any problem we face through parenting program. For example, if we face some problems on father session, we can adapt, or we can adapt it or solve it, or prepare another activities on this learning circle. And actually, we did the analysis through pre-post evaluation through our M&D focal point.
Yeah, I'll just add on what Salah mentioned. I think a couple of things that were done consistently throughout the program is that we did have same-sex groups of young people meeting with same-sex coaches. So young women and adolescent girls were meeting with female coaches, and same for young boys and adolescent boys. That was to create that social and physical safe space. And the other piece that was, I think, critical, and I pulled back up this photo of this Q&A slide, was there was a component to the program that was outdoor education and adventure learning, which initially for the first 2 or 3 years that we ran it was really kind of only acceptable for parents and the community for young boys. And over time, we advocated with parents to make that accessible to adolescent girls and young women as well. That took some parent engagement. It took bringing mothers out on hiking trips, and as you can see in this photo, this was a team building, self-esteem building activity where young people would go out into nature, engage in, physically and emotionally challenging activities like rock climbing, and to do that as a team. And over time, I think what we found was some very encouraging results specific to adolescent girls. I can't say that all of those were intentional, but that over time they became more intentional, such as this adventure outdoor education program activity.
That's great. Thanks so much.
I hope that answered the question.
Yeah, for both of you sharing. And we want to do a little bit of a non-traditional part in that. Matthew, you did mention that Catherine, who is one of your researchers, is participating. And so wanted to see if we could get her unmuted and so that she could speak to it as well. As she said that she had a couple of points that she would like to make around this question as well. Catherine, are you able to get yourself off of mute and... Doesn't look like it. Oh, there we go, maybe.
Hello.
She just did.
Are you hearing me?
Yes, we hear you.
Yes, we are.
Okay, very briefly, I just wanted to also add a point about when developing tools for research that the language issue is very important by gender. For instance, what we found was when we were in evaluating the extraordinary work that Mercy Corps team was doing, using words like, do my parents look after me, for boys was enabling, but for girls had the tinge of surveillance. And so girls and boys told us different things about the way parents looked after them, which we had to be very, so my point is that the language as well of the tools that you ask has to be very nuanced by gender. And one example is look after can mean I follow you to find out what you're doing, kind of thing. So a lot of this really good question about gender had to be carefully understood locally in terms of the simple vocabulary when we're talking about stress, poverty, trauma, etc. Cultural vocabulary really matters. And I just wanted to make that example because one of the great things that the Mercy Corps team did do was to pay attention to this regional underpinning of how it is rooted in the community. So I just wanted to introduce that point in terms of the way you speak about things, the way you communicate clearly, and how you listen to ways girls and boys tell you about what's important in their community really mattered. And for a researcher like me, it was very obvious in terms of the rollout of that program with parents and adolescents.
Great. Thank you so much for all of you sharing on that. And kind of staying on that same gender track, there's another question that came in from Laurette about, did the program find that girls were at risk of early marriage or sexual, as refugees? And if so, how were you guys able to manage that and refer them to other services?
Do you want me to answer that question?
I think maybe go back to Matt first.
Yes.
And kind of Matt, then let you
Matt
direct back of who would be best to address that from Mercy Corps side.
Yeah, I think, Salah, the question around early marriage for adolescent girls and gender-based violence, if we saw that as an issue that we needed to work on with our coaches, or if that was something that was referred to additional services at the community level through the community protection networks?
Actually, we find the early marriage, especially in the locations near Syria, like Irbid or Mafraq, or because Mafraq it's behind the Za'atari camp. We find a lot of cases in early marriage, actually, and sexual abuse, actually, and we do the referral through our well-being focal point, because we did the referral map at the beginning of the program, and we do the referral to all cases we found.
Yeah, and I would just add, and Catherine, feel free to jump in here, what came out through the research, but during the intake process, there was an extensive vulnerability kind of tool that was used to assess vulnerability of young people, and prioritization given to those who had higher levels of vulnerability. And I'm trying to remember off the top of my head whether exposure to gender-based violence was one of those, and whether that was a consistent or reliable self-report. Obviously, I think we would see some bias toward not reporting that. But, I do know that it was documented much more within camps like Azraq and Zatri camps, and a lot of research done there. I don't know the degree to which it was been documented and substantiated within those communities. I did want to just say, because I don't think we've talked about it as part of the presentation, and sorry to skip one of the other questions, but I think one of the key contributions of this program, it being community-based, was a really important factor. And I think within the social emotional learning field, there's this debate about school-based or community-based. And I do want to highlight that, one of the things that we found consistently across the program, not only in Jordan, but in Iraq and in Lebanon, was that the ability for young people to establish meaningful relationship with coaches who were community members, who were trained on the profound stress and attunement approach, who were trained to connect empathetically and in a caring way with young people. Young people in the qualitative research, across the board said that those relationships were strong, they were constructive, and they were enabling. And I think that we contrast that often with relationships with teachers in more formal school settings. They don't describe those relationships as caring or as constructive, and sometimes as violent or destructive. So I think, as we think about social emotional learning, that's not to say that it takes place better in community centers with coaches. It just says that we might have a bit more work to do when we do that social emotional learning with teachers in formal school settings, where for a long time, the ideal teacher is one that is more of a disciplinarian and is more rigid in their approach. I do think that works counter to teachers' efforts to establish and engage in social emotional learning. So just to put that out there as a debate, and I think there is more that can be done at the community-based or non-formal education settings to really advance social emotional learning. Sorry, Hilary, I just wanted to put that in.
Actually, I think that is a great way of being able to end the conversation of, really kind of putting forward some of those challenges of how do we make this happen, and where is this learning best fitted in. And, something that you guys had highlighted earlier in the presentation, it really is based on those safe spaces, that emotional and physical safe spaces, and those relationships that build that. So thank you, Matt. That was a great ending point. But as we see, unfortunately, our time for today's webinar has come to an end. But before we officially close out, I would like to say several thank yous. I would like to thank our three presenters today for sharing their experiences and perspectives with our larger community of practice. With your willingness to share today, it helps all of us build on the existing knowledge and experiences out there, and which then in return allows us to advance the practices of youth development globally. I would like to thank all of our participants for taking the time today to listen in and to engage with us and ask questions. We're thankful for all of your time there. Lastly, I would like to thank our Youth Power Learning team, and in particular Rachel Sepka and Jessica Carrera, for all of your efforts behind the scenes and in front of the scenes in making sure that this webinar today is possible. For those of you who are interested in today's recording, the webinar will be posted to the Youth Power Learning website, and there will be a link on the cross-sectoral community of practice page. There's multiple ways of staying engaged, and I will go ahead and turn it back on over to Rachel to be able to talk about what you can do next of staying involved with Youth Power Learning. But thank you very much from my side. On to you, Rachel.
Thank you, Hilary, and thank you, everyone, presenters and everyone for participating. So what can you do next? You can join a Youth Power community of practice, like I mentioned before. Visit our website for resources, best practices, and knowledge shared. If you have any materials that advance the evidence base for positive youth development, we'd love to see them, so please email us at info@youthpower.org. And as Hilary mentioned, we will be sharing the recording and the slide deck for today's webinar for everyone who has registered. So check your email in the next few weeks on youthpower.org for that. Thank you again, and have a great day and rest of your evening, everyone.